Hello, I want to talk about brushing, how to brush your teeth, and some of the common mistakes that people make. Brushing teeth when done well should be very effective, should help you prevent things like cavities and gum disease. So I'm going to take you through some of the mistakes that people make and how you should brush, when to brush, how many times a day, and which tools to use. I'm going to use this model to demonstrate how to brush your teeth correctly and some of the mistakes that people make when brushing their teeth. So this model, we're going to look at this outward surface, the inward surface, and the biting surfaces. So the first thing that you need is a proper toothbrush. A toothbrush should be not too hard or not too soft, but it should be firm with nice bristles, and you remember to change it every 3 months because that's when the bristles start to wear out. So you're going to need a fluoridated toothpaste. Any fluoride based toothpaste is going to be okay. So when you're brushing, you want to get into the gum. Where the bacteria and the food substance tend to sit is within the gum line and also on the tooth. But you know, when you brush like this, back and forth, you're not getting to the gum, so you're just brushing the tooth. So you want to have a technique that not only removes the dirt and the tooth substance from the tooth, but also from the gum. So you're going to, this as you can see is my lower model and this is my upper model. So you're going to angulate the toothbrush bristles to get into the gum by putting them at 45 degrees angle, not straight. Notice it's not straight, but it's a bit angled. So you're going to angle them like this, but even when angling, part of the bristles are also touching the tooth surface. So it's both on the gum and the tooth surface. So you're going to do short strokes, continuous strokes with some of the bristles in the gum and some on the tooth surface. So you're going to brush the whole outward area. Don't be in a hurry, don't be aggressive. Again, I mentioned there are some of the mistakes, like if you're brushing back and forth or too aggressively does not clean better. If anything, what you're doing is wearing out your tooth surface. So you remember to angle the toothbrush towards the gum. If you're brushing on the upper, the same thing, you're just going to angle it now a bit upwards. So it's going to look like this. Some of the bristles are in the gum and some are on the tooth. So this is what you're looking at on the upper. So remember, you not only brush the outwards, but also remember to brush the biting surface, which you're just going to do it like this and like this. And then also remember to brush on the inner surface. This goes for both the upper and the lower. The technique does not change. It's the same thing. However, when you're brushing on the front teeth, you might want to put the brush vertically like this, so as to make sure you're removing everything that is on the tooth surface. The same thing that goes for the upper and the lower. And remember to always brush your tongue. That's another thing that people tend to forget, and then you end up having bad breath. Remember to always brush your tongue. So to recap, you want to have your bristles in the gum and part of them on the tooth, and you're going to do in a circular motion, like you're almost massaging the tooth. Remember the three surfaces of the tooth: the outward surface, the inside surface, and the biting surface. When you get to these areas where you may not be able to do that, you're going to put your toothbrush straight forward like this, and then you're going to put it vertically and make sure you're removing all this dirt. Then this whole process should take you at least 2 minutes. 2 minutes is sufficient. Remember, I mentioned to use a fluoridated toothpaste. Now, when it comes to the debate of do I spit out the toothpaste or do I leave the toothpaste, ideally we don't want to rinse out the toothpaste, because what we are looking at is the fluoride. The fluoride that is within the toothpaste, if it's left with in contact with the surfaces of the teeth, then in that case you may be able to benefit for longer periods from the fluoride. So that is how you brush your teeth. Remember, it's a 2 minutes procedure. Then you're going to use the three surfaces: the outwards, the inwards, and the surface. And then you're not going to do it too aggressively. Brush the tongue and change your toothbrush every 3 to 4 months. And then you're going to look for a toothbrush that has good bristles, and if you look, like some even have with a tongue massager here, or you can actually just turn it and then you scrape out any dirt from the tongue.